often find it hard to remember recent events? Do you struggle to recall familiar names or places? If yes, these could be early symptoms of Alzheimer's disease. Hey everyone, welcome back to our channel. Today, we're diving into a topic that impacts millions of people worldwide, Alzheimer's disease. In this video, we will explore what Alzheimer's disease is, its causes, symptoms, treatment options, risk factors, lifestyle tips, and some natural approaches to managing the condition. Plus, we'll share 7 brain-boosting foods to support cognitive health. Now, let's get started. What is Alzheimer's disease? The most prevalent kind of dementia is Alzheimer's disease. The illness progresses gradually, causing modest memory loss at first and maybe eventually impairing one's ability to respond to events and carry on conversation. The brain regions that regulate language, memory, and thinking are affected by Alzheimer's disease. It may have a major impact on an individual's capacity to do everyday tasks. Alzheimer's disease is one of the top 10 leading causes of death in the United States. In 2020, an estimated 5.8 million Americans aged 65 years or older had Alzheimer's disease. Before moving towards the next point, please like, subscribe, and share this video. Symptoms. Memory problems are typically one of the first warning signs of Alzheimer's disease and related dementias. In addition to memory problems, someone with symptoms of Alzheimer's disease may experience one or more of the following: memory loss that disrupts daily life, such as getting lost in a familiar place or repeating questions, trouble handling money and paying bills, difficulty completing familiar tasks at home, at work, or at leisure, decreased or poor judgment, misplacing things and being unable to retrace steps to find them, changes in mood, personality, or behavior. Causes. It's unclear what exactly causes Alzheimer's disease. However, basic brain protein functions are disrupted. This interferes with the function of neurons, which are brain cells, and sets off a chain of events. The neurons sustain harm and stop communicating with one another. They pass away gradually. Scientists surmise that a mix of hereditary, behavioral, and environmental variables that gradually alter the brain is responsible for the majority of cases of Alzheimer's disease. A person is nearly certain to get Alzheimer's disease if they have certain genetic abnormalities, which account for less than 1% of cases. Usually, the sickness starts in middle age in these patients. The development of the disease begins years before the first symptoms. The damage most often starts in the region of the brain that controls memory. The loss of neurons spreads in a somewhat predictable pattern to other regions of the brain. By the late stage of the disease, the brain has shrunk significantly. Researchers trying to understand the cause of Alzheimer's disease are focused on the role of 2 proteins. Number 1 is plaques. One piece of a bigger protein is beta-amyloid. These pieces appear to be harmful to neurons and to interfere with intercellular communication when they aggregate together. These clusters combine with other cell debris to produce bigger deposits known as amyloid plaque. Number 2 is tangles. Tau proteins play a part in a brain cell's internal support and transport system to carry nutrients and other essential materials. In Alzheimer's disease, tau proteins change shape and organize into structures called neurofibrillary tangles. The tangles disrupt the transport system and cause damage to cells. Risk factors. Age. Growing older is the biggest recognized risk factor for Alzheimer's. Alzheimer's disease is not a normal aspect of aging. However, your chances of getting it rise with age. One study found that every year, there were 4 new diagnoses per 1,000 people ages 65 to 74. Among people ages 75 to 84, there were 32 new diagnoses per 1,000 people. Family history and genetics. The risk of developing Alzheimer's is somewhat higher if a first-degree relative, your parent or sibling, has the disease. Just how genes among families affect the risk is largely unexplained, and the genetic factors are likely complex. Excessive alcohol consumption. It has long been recognized that heavy alcohol use alters the brain. Drinking problems have been connected to a higher risk of dementia, namely early-onset dementia, according to several big studies and reviews. Poor sleep patterns. Research has shown that poor sleep patterns, such as trouble falling asleep or staying asleep, are linked to an increased risk of Alzheimer's disease. Lifestyle and heart health. Research has shown that the same risk factors associated with heart disease also may increase the risk of dementia. It's unclear if these factors increase risk of dementia by worsening Alzheimer's changes in the brain or by leading to brain vascular changes. They include lack of exercise, obesity, depression, smoking or exposure to secondhand smoke, high blood pressure, high cholesterol, poorly controlled type 2 diabetes. While there are some risk factors for Alzheimer's you can't change, like age and genetics, you may be able to manage other factors to help reduce your risk. How to prevent? Research shows that having a healthy lifestyle helps protect your brain from cognitive decline. The following strategies may help decrease your risk of developing Alzheimer's disease. Stay mentally active. Engage in brain-taxing activities such as board games, reading, crossword puzzles, playing an instrument, or other pastimes. Get physically active. Exercise increases blood flow and oxygen to your brain, which may affect brain cell health. Wear protective headgear if you're participating in activities that increase your risk of a head injury. Stay socially active. Regularly talk with friends and family and join in on group activities, such as religious services, exercise classes, book clubs, or community volunteer work. Eat healthily. Follow the Mediterranean diet or another healthy diet that includes antioxidants. Avoid alcohol. Talk to your healthcare provider if you're concerned about your risk of developing Alzheimer's disease. Treatment, medications, and other interventions can also help with behavioral symptoms, handling changes in behavior. You can assist manage behavior changes and ensure your loved one is comfortable in their surroundings if they have been diagnosed with Alzheimer's disease. Keep the surroundings comfortable for them. Don't change their living area's design or arrangement. Keep an eye on their comfort. Give them comfort items, such a blanket or teddy animal they love. If they appear stressed, try shifting their focus elsewhere. Aim to stay out of conflict. Brain-boosting food. Berries. Decrease oxidative damage and inflammation and improving memory. Citrus fruits. Citrus fruits are high in vitamin C, boost neurotransmitters, and improve attention and concentration. Dark chocolate, flavonoids, caffeine, and antioxidants found in dark chocolate help to improve blood flow, lessen inflammation, and increase concentration. Nuts. Nuts offer good fats, antioxidants, vitamin E, and brain cell protection. They also give you continuous energy and help you focus better. Eggs. The vitamins B6 and B12, folate, and choline found in eggs help with memory and mood management. Avocados. Avocados are a good source of monounsaturated fats, vitamin K, and folate, which can aid with blood flow, blood clot prevention, and cognitive enhancement. Salmon. Omega-3 fatty acids found in salmon enhance the structure of brain cells and enhance memory and cognition. Extra virgin olive oil. Prevent brain damage and improve mental health. If you found this video helpful, don't forget to like, subscribe, and share this video. Thanks for watching.